Good evening. Thank you all so much for joining us today. My name is Lisa Farnham, and I'm a member of the Field Outreach Team at Blue Cross and Blue Shield of Massachusetts. Part of my job is crossing the state and talking about health insurance, talking about Medicare and Blue Cross products. And we are in senior centers, libraries like this evening, hotels, etc. This evening, even though I work for Blue Cross, I'm not going to talk about Blue Cross plans at all. I'm just going to talk about how this all works when you go on to Medicare. So this is a presentation for caregivers, but it can help anyone as they approach age 65. So I will talk about original Medicare. Here's our agenda. We'll talk about when and how to sign up for Medicare. We'll talk about original Medicare, the benefits, how it works, etc. We'll talk about the other health plan options that are available to you. And then we'll talk about some helpful resources that are out there, because there's a lot of help out there. Everyone should have a copy of the slides in front of them. So those are for you. Feel free to take notes. And we're going to get started. So we're going to start by talking about original Medicare. So original Medicare is health insurance that's provided to you by the federal government. There are two different parts. Medicare Part A provides your benefits for your inpatient services. So think about when you're in the hospital and you have room and board charges, prescription drugs when you're in the hospital, tests, things like that. Everything except for your doctor's services are part of Medicare Part A. And Medicare Part A is premium free because you've worked and paid into the system. Medicare Part B is your outpatient services and your doctor services. So this could be something like a lab or an x-ray done on an outpatient basis. This could be an emergency room visit, an ambulance ride, a visit with your doctor, things like that. And in 2023, Medicare Part B does have a premium, and the premium for most people is $164.90. That's per person per month. When you go on to Medicare, you're actually going on as an individual. It's a one-person policy. Different from when you were working and you might have had a two-person plan or a family plan. So all of the benefits and the dollar amounts that I'm going to share today are per person. The good thing to me about that is you don't need to take the same type of plan as your spouse. So if you think about it, you have different medications that you take, different doctors that you see. So you don't have to follow that same path that your significant other does. The Medicare Part B premium is based on what's called your modified adjusted gross income. And I have a slide later in the presentation that will explain this a little bit more. But basically it's income based. And so if your income is higher, your Part B premium may be higher for that particular year. And again, we'll talk about that shortly. The way that Medicare works is you can see any doctor, any hospital, any provider, anywhere in the United States, as long as they have a contract with and accept, participate, if you will, with original Medicare. And again, anywhere in the United States, so you don't necessarily just need to stay in Massachusetts. This is not an HMO or a PPO or a managed care plan. So you don't have to get a primary care provider. You don't have to get referrals for services. So there's a lot of flexibility and a lot of choice for providers, again, as long as they accept Medicare. And there are some benefits available with original Medicare for some routine services as well. But on original Medicare, you will be responsible to pay a deductible or some deductibles and some co-insurance. So there's cost share for you with original Medicare if you just took original Medicare. So as I do these presentations, this is the biggest question I get. So when do I enroll and how do I enroll? And everybody has their own kind of unique situation. So it's really not a one-size-fits-all, but in general, people find themselves in one of three scenarios. So the first scenario is you're turning age 65 and you happen to already be collecting your Social Security benefit. So maybe you started at age 62. If this is you, then you actually don't need to do anything. Social Security already knows about you, and about 3 months prior to your 65th birthday, they're going to send you something offering you or asking you if you want to enroll in Medicare Part A and Medicare Part B. So if you want to, you say yes, and then they will enroll you. They'll start taking your Medicare Part B premium out of your Social Security check. Your Medicare plan, your effective date for Medicare, is always going to be on the first of the month in which you turn 65. So my birthday is March 8th. My Medicare, if I was turning 65 on March 8th, would begin March 1st, even though I'm not yet 65. The only exception to that is if you are born on the first of the month. So if you're born on the first of the month, Social Security actually goes back a month. So if I was born March 1st, my Medicare benefits would begin February 1st. So that's important to know. When you go on to Medicare again, your coverage would always start the first of the month in which you turn 65. Even if you're starting the process earlier than that. It's always going to be that first of the month. So that's scenario one. Scenario two is you're turning age 65, you're not already collecting your Social Security benefits, but you want your Medicare Part A and B benefits. So here you need to act. You need to reach out to Social Security and say, raise your hand and say, I do want Medicare A and B. You want to do this, you have what's called an initial enrollment period. It's a 7-month period of time. So you have 3 months before your 65th birthday, your birthday month, and 3 months after that 65th birthday. So that 7-month period of time in which to sign up for Medicare without any late enrollment penalty. So if you start that process, I always recommend people start it 3 months before. Again, it will still be effective as of the first of the month. You're not getting coverage 3 months early, but it's good just to have kind of all your ducks in a row. Let me see, anything else in this? I think that's it for those two scenarios. So again, the first, you don't need to do anything, they're coming to you. The second scenario, you need to act and go to Social Security. And in a few moments, I'll share Social Security's website and telephone number. So the last scenario is becoming more and more popular, if you will. People are living longer and working longer. So if you decide to continue to work past age 65 and you work at a company that has 20 or more employees and you have their health insurance plan and you're actively working is the key part of that. So that doesn't mean COBRA, that doesn't mean a retiree plan. You need to actively be employed. Or you have coverage through your spouse and he or she is actively employed at an employer that has 20 or more. So if that's the case, you can continue on your employer plan past age 65 for as long as you are actively working. You don't need to call Social Security and say, I'm not going to take Medicare. You really don't need to do anything. You can, if you wish, sign up for Medicare Part A. So remember, Medicare Part A is premium free. It covers your inpatient services. It would be secondary to your employer plan. So if you would like, you could, again, sign up for Medicare Part A. You're not going to get a lot more benefits, again, because your employer plan is primary, but sometimes people like to do this just to start the process and familiarize themselves with the process. If you happen to work past age 65 for an employer that has less than 20 employees, they do want you to enroll in Medicare A and B prior to your 65th birthday. So if it's a smaller company, you do want to enroll in Medicare A and B. So what happens if you're working for a larger company? Let's say I'm working and I work until I'm 68 and I decide it's time for me to retire. I would go to Social Security, I would call them, or I would go to their website and I'd say I'd like to enroll in Medicare Part A and or B, or and B. And they would say, Lisa, where have you been for the past 3 years? Because I waited until age 68. And I'm going to say I've been actively working. They'll ask you a question, have you been actively working? And I'm going to say, yes, I have. And they're going to give me a form that I'm going to then take to my employer, my Human Resources Department. And my Human Resources Department is going to say, yes, Lisa's been working since age 65. She's had coverage with us. So in that way, you're not getting any kind of late enrollment penalty. Medicare does want you to take Medicare when you're first 65. So again, it's okay if you wait and you're still getting coverage through your employer. But once you no longer either voluntarily or involuntarily lose your employer coverage, you want to start that Medicare process. Now, there's one exception when you do not want to enroll in Medicare A. And again, Medicare A is totally optional. But if you happen to, through your work, have something called a high deductible health plan. The high deductible health plan is generally paired with something called a health savings account. And the health savings account and the high deductible plan are the only insurances you can have. So there are tax implications if you enroll in Medicare and continue to contribute to your health savings account. So the recommendation is about 6 months prior to your going on to Medicare, you should stop your contributions to your health savings account. And this is again something you could talk to your accountant about, talk to your Human Resources Department about for more information, but again, I just wouldn't want anyone to have be charged taxes on that. Social Security's telephone number is listed below there as well, and I'm going to provide it in just a moment. So I want to just quickly go over how Medicare works, what the Medicare benefits are. So for Medicare Part A, and this is only if you have no other insurance. So if you just have Medicare Part A, if you're inpatient in the hospital for day 1 through 60, you would be responsible to pay that hospital a $1,600 deductible. It's a per benefit period deductible, which I'm going to come back to in just a moment. Let's say after 60 days, you're still in the hospital. Day 61 through 90, your costs go up, and it's a $400 daily co-insurance that you're now paying the hospital. Still in the hospital after that, day 91 through 150, your costs go up to $800 a day. Again, that's you paying the hospital, and Medicare picks up the balance. Still in the hospital, again, consecutively after 151 days, you're responsible for the entire bill after day 151. So let's talk about a benefit period. A benefit period starts when you are admitted to the hospital or to a skilled nursing facility, and it ends when you've been out for 60 consecutive days. So let me just give you an example. Let's say I have knee surgery and I'm inpatient in the hospital for 5 days. I would be responsible to pay the $1,600 deductible for Medicare Part A. I'm discharged, and let's say maybe 2 weeks later I go back and see my surgeon for follow-up, and unfortunately something didn't go well, and I end up back in the hospital. It really doesn't matter whether it's related to my original knee surgery or not. It could be a brand new condition, but I'm 2 weeks out and I'm back in the hospital overnight. Because I've only been out for 2 weeks, I'm still in that same benefit period. So when I go in for the second time, my second admission is going to start where my first one left off. So it's going to be day 6, day 7, day 8, etc. And I won't have to pay that $1,600. Conversely, let's say I'm in for 5 days, I pay the $1,600 deductible, and then let's say I'm out of the hospital for 6 months, and then I end up back inpatient overnight. Because I've been out for 60 days or more, that starts a new benefit period, and I'm going to be charged. I'm going to start again when I go in again, day one, and I'm going to have to pay that $1,600. So I think I bring this up because I think we're trained at this point to think of deductibles as a calendar year, but the way that Medicare benefit works, that's not the case. It's per benefit period. Skilled nursing facility. So this sounds like it's a nursing home. It's actually not. Really what this is sometimes you're in the hospital and you're getting better, but you don't need the level of care in that particular hospital, but you're not ready to go home. So what will happen is you get transferred to, it's called a rehabilitation hospital. Folks might have heard of that. So that's what this skilled nursing facility is talking about. So Medicare Part A will provide benefits for this in full for your first 20 days. And day 21 through 100, you're going to be responsible to pay $200 in co-insurance each day to that skilled nursing facility. After that, day 101 plus, you're responsible for the whole bill. The other thing that's important to know about this is the way Medicare administers this benefit. Medicare will only provide the skilled nursing facility benefit if you're inpatient in the hospital for 3 days and 3 nights, and then you get transferred to a skilled nursing or rehabilitation hospital. So you have to be in 3 days and 3 nights before this benefit is available to you. Medicare Part B, again, doctor services and outpatient benefits. It's a lot easier to understand. There's a calendar year deductible. So in 2023, it's $226. Once that's deductible, and that's your responsibility, once that is satisfied, then Medicare pays 80% of their allowed amount, and you would be responsible for 20% of the allowed amount. And that goes through the end of the year, December 31st, and then we'll reset January 1st. Some things that are not covered by original Medicare. So there's no benefits for prescription drug coverage. There's no benefits for any services outside of the United States, whether they're emergency or urgent or not. There's no benefits available for any dental services, routine dental, routine hearing exams, or routine vision exams. So this slide, we're on page 8. This slide gives you a really good look at how everything works once you go on to original Medicare. So everything starts with that dark blue box. So we just talked about Medicare. So at a high level, it's an 80%, 20% plan. Medicare Part A is premium free. Medicare Part B has a premium. You could say that's enough insurance for me and stop right there if you wish. But generally, people add additional coverage to pick up where Medicare leaves off or to pay for services Medicare doesn't provide benefits for. And there's 2 ways that you can do this. So the first way on the left-hand side is you could purchase something called a Medicare supplement plan. This is exactly what it sounds like. This plan supplements Medicare. It follows Medicare and picks up where Medicare leaves off. That's included right in here. The most popular plans, the most popular Medicare Advantage plans are usually between $0 and $100 per person per month. So the premium's lower. But I call these plans pay as you go because as you go for services, you're paying a co-payment or a co-insurance. So if you see your primary care provider, you may have a $10 co-payment. If you get a lab or x-ray, you might have a certain co-payment. If you have services in the hospital, you'll have cost share. So you're paying as you go for care, different than the other side of this chart where you're not paying as you go, and this picks it all up. These plans, again, the premium's less. You're still paying your Medicare Part B premium in either path, but these can be as low as $0. And it's, again, just a different model. So there are plan rules with the HMOs and PPOs that you need to follow. And we're going to dive into each of these boxes. So let's start with Medicare supplement plans. So if you've done any reading, you might have seen the term Medigap. Medigap and Medicare supplement mean the exact same thing. Those two words are used interchangeably. And it's a plan you're purchasing from a private insurance company, and it is picking up where Medicare leaves off. So it's paying those leftover amounts. So in Massachusetts, there are 3 different types of Medicare supplement plans, and they're regulated by the Division of Insurance. So there is a supplement core, a supplement 1A, and a supplement 1. Those are the 3 offerings here in Massachusetts. Outside of Massachusetts, if you've done any research, you might have heard of letter plans, so Plan A, Plan B, Plan C, etc. Other states could offer up to 10 different plans, and they do offer, their rules are different. So if you go for care, and you're going to show your doctor both cards. So first you're going to show them your Medicare card. Doctor or hospital will bill Medicare. Any leftover amount will go back to the doctor or hospital. If you have no other insurance, you need to pay that. But if you have a Medicare supplement plan, the doctor or hospital will bill your Medicare supplement plan for that leftover amount, leaving you again little to no balance. Some other important things to know about these Medicare supplement plans. You can continue to use Medicare the way it was meant to be used. So you're seeing any doctor, any hospital, anywhere in the United States as long as they accept Medicare and have a contract with Medicare. You don't need to get referrals. You're not paying as you go. So these plans, again, are literally following Medicare. Some, they generally provide, again, just the Medicare A and B benefits. Some plans may add a small few extra benefits, but generally they follow Medicare. So this chart shows you those Medicare Part A and B benefits that we reviewed a little while ago, and it overlays the Medicare supplement plan. So the way you read this chart is anywhere you see a green check mark, that means that that plan picks up the Medicare balance. So let's review it. So that Medicare Part A $1,600 deductible, both the Supplement 1A and Supplement 1 plans pick that up for you. The Supplemental Core plan does not. You would be responsible for the $1,600. Part A, inpatient hospital coinsurance, that $400 or that $800, all 3 of those plans will pay that $400 or $800 daily amount for you. Part A, skilled nursing, that $200 a day, the Supplement 1A and the Supplement 1 will pay for you. The core plan, you would be responsible to pay that. Part B deductible. So, the only difference between the Supplement 1 and Supplement 1A plans, there's actually 2 differences. Supplement 1 is the premiums, so the premiums differ from these 2 plans. Supplement 1A is always less. The other difference is the Part B deductible. So Medicare, the Supplement Core and the Supplement 1A do not pick up that $226 Medicare Part B deductible. But the Supplement 1 would pay that $226. And there's a note in the corner there. A law went into effect that was called the Medicare Chip Reauthorization Act. It went into effect on January 1st of 2020. Basically what it said is for anybody who is not yet eligible for Medicare as of 1/1/20, you are not eligible for that Supplement 1 plan. So for those in the room that are not yet 65, you want to cross that Supplement 1 plan out. You unfortunately are not eligible for it. But again, the Supplement 1A plan is just as good, if not better. So all 3 plans pick up that 20% Medicare approved amount, that 20% coinsurance. Services received outside of the United States. So all the Supplement 1A and 1 will provide you your Medicare A and B benefits outside of the country. So say you go to Italy and you get strep throat. They probably will not recognize your Medicare supplement or Medicare cards or Medicare supplement card, but you can pay out of your pocket and then get reimbursed by your company. Outpatient prescription drugs, just as a reminder, not covered at all on these plans. So a couple other kind of cool things about these Medicare supplemental plans. They're portable. And what I mean by that is, let's say, so you have to live in Massachusetts when you apply and enroll, but say 6 months later you decide to retire to Florida. You are able to take these plans with you. What I always recommend to people is to take a look at the plans in the state that you're going to and compare and contrast. But if you wish, you can keep this plan because, again, you're seeing any doctor, any hospital that contracts with Medicare anywhere in the United States. So if you decide to keep this plan, you are welcome to. If at a future date you decide to take the plan in the state that you're moving to, you can't then go back and enroll in this because you no longer live in Massachusetts. And these are the only types of plans that you can do this to, that portability. The other great thing about these plans is that you can enroll at any point. You don't have to wait any point after you are age 65, you live in Massachusetts, and you meet the other criteria, but you can apply. You don't have to wait until October 15th through December 7th when it's open enrollment time. So you could apply now, and your plan would be effective the first of the following month. Last but not least, one of the great features of these plans is, let's say you enroll, you had a relatively healthy year over the last year, so you decide to take the Supplement Core plan. The Supplement Core plan has the least premium, and again, there's some costs for you. You find out next month you're going to need to have some knee surgery, as an example. That you can call your insurance company and say, I'd like to upgrade my coverage and move from the Core to the 1A, effective the first of the following month, and then you're going to pay the new premium, but you're going to get those benefits. So you would get a benefit to pay that deductible, as an example. So maybe you stay on the Supplement 1A for 4 months as you get your physical therapy, you get your services, and then you decide to go back. So you could then go back to Core. If you wanted to, you could do it every month. There are some rules for the Supplement 1 plan for those who are eligible. For the first time when you enroll, you generally need to stay in that plan for a year before you can make those movements. So, Medicare prescription drugs. So again, if you remember that chart from the beginning, we've talked about Medicare, we've talked about Medicare supplement, and now we're going to talk about prescription drug coverage. This is also referred to as Medicare Part D, D for drugs. This is always your outpatient prescription drug benefits, so drugs you're getting at a retail pharmacy or through a mail order. And you're always going to get it from a private insurance company. So you're not getting it from the federal government, you're getting it from a private insurance company. And they sign a contract with the Center for Medicare and Medicaid Services. You're paying a premium for these plans. In Massachusetts, there's probably about 30 different prescription plans available. And the premiums range from as low as probably $10 or $12 to as high as a couple $100, depending on the plan. There are some things that are the same for all Medicare Part D plans, and that's these coverage levels. So the initial coverage level, there is an allotment. It's $4,660 that you can spend on total drug costs. For some people, that's more than enough money for the entire year, and they're never going to leave that initial coverage level. And then it resets on January 1st. For others, if you reach that amount, you move into something called the coverage gap. The coverage gap, for anyone who might have heard this term, used to be called the donut hole. It's not called the donut hole anymore. It was called the donut hole at the time because there was no coverage. but fortunately now there is coverage, and you're paying a 25% co-insurance in that coverage gap, and the plan's picking up 75% for you. There is then something that is called catastrophic coverage level. And so once your out-of-pocket costs reach a certain amount, and this year it's $7,400, and that is, again, your co-payments, any deductibles you might have, your 25%, all of that reaches that $7,400, you then go to this catastrophic coverage level. So those coverage levels are the same no matter what Part D insurance you buy. What's different about Part D plans is what's listed on the bottom. So the deductible. So you could purchase a plan that has a deductible or doesn't have a deductible, or has a deductible for just a couple medications, a couple different tiers. The deductible will never be more than $505 this year. But again, it depends on the plan, and you may have not any deductible. The cost share. The cost share is either a co-payment, a flat dollar amount, or a co-insurance, a percentage that you're going to pay for your medication. That's going to vary by insurance plan. So it's important that you look before you buy and look at the drugs that you're on and see what the cost is. The pharmacy network is the other thing that differs. So that's basically where can you go to get your prescriptions filled. So that may vary by Part D plan. And last but most importantly is something called the formulary. So the formulary is really just a list of covered drugs. So it's a big list, and what they do is they divide that list into different tiers. And based on the tier, that will determine what you're going to pay for your prescription. So you want to make sure you check the formulary before you purchase a plan to see if your drugs are covered on that plan. If you happen to have coverage through your work, let's say I'll just use Blue Cross as an example. If you have Blue Cross through work, you retire and you take the Blue Cross plan, when you retire, one of these direct pay plans, don't assume that the formulary listing is the same. It will not be. So again, if you use the same insurance company, the formularies do vary and are subject to change. So that's a really important step. You can access the formulary on the insurance company's website. You can call the insurance company and ask for a copy to be mailed to you. You could ask the insurance company to help you look up your medications. Medicare.gov, G-O-V, their website has something called Plan Finder. And Plan Finder lists, you can input the medications that you take, the doctors that you see, etc. And it'll cross insurance companies and give you a list of the plans that might work best for you. There's an important note at the bottom that says, join when first eligible to avoid a late enrollment penalty. This is really important. So at age 65, let's say I don't take any medications. So I decide, why should I be paying for a Part D plan if I don't take any medications? That's my prerogative, I can do that. And if I never take any Part D plan for the rest of my life, I'm fine. But let's say 10 months after I turn 65, unfortunately, I start to go on some medications. And I decide I want to enroll in a Part D plan. I can do that. However, because I waited 10 months after my 65th birthday, I'm going to be assessed a late enrollment penalty. So the way it works is they look at the national average premium for Part D plans. This year it's about $35. So they then take 1% of that, which is 35 cents. Not a lot of money. 35 cents, though, is then multiplied by the number of months or years that I waited to get the insurance. So in this example, I waited 10 months. It's just easier math. So my late enrollment penalty will be $3.50. So I will be charged that in addition to my Part D premium every month for the rest of my life. So the moral of the story is, at age 65, if you're still working and you have what's called creditable coverage. So that means you have prescription drug coverage through your company that's as good as or better than this, you're all set. But at age 65, if you're not working, you should enroll in a Part D plan. But as I mentioned, there are some out there that are as low as probably $12 in premium. So I would hate to have anybody be charged a late enrollment penalty for the rest of their lives. And I have unfortunately met people who have had $5 ones and some people that have had $40 ones. So it's really important that you take a Part D plan. So this just shows exactly what I just described. These are the coverage levels. So at a minimum, these are the benefits that you're going to see for your Part D plans. So there could be a calendar year deductible that you would be responsible for that's up to $505. Some plans may not have any deductible, or some plans may have it just on certain tiered medications. Once you pay or reach that deductible, you move to that initial coverage level. In here, there's that allotment of $4,660. This is total retail cost. So what that means is, let's say I'm on Levoxel, and Levoxel costs $100, this is all made up, $100 for a 30-day supply. And my plan tells me that I owe $10, so I pay $10 to the pharmacy for that 30-day supply, but it costs $100. So my plan pays that $90. That total amount, both what I paid and the plan paid, the $100, is then deducted from the $4,660. So then I have $4,560 left to spend that calendar year. Next month I do the same thing, so it keeps whittling down. So for some people, you may not even spend this in a calendar year. For others, this may take you 6 months, 3 months. This could be the cost of one pill for some folks. So if you don't reach this all resets. These numbers are subject to change at the beginning of 1/1/24. If you reach this, you then move to that coverage gap. And in that coverage gap, you're paying again 25% of the cost of generics or 25% of the negotiated price for brand name drugs. And that does exclude any dispensing fees. A dispensing fee is usually $1 or $2 sometimes that pharmacies charge to dispense certain medications. So when you're in that coverage gap, there's a calculation that's also going on behind the scenes that starts at the very beginning and adds your deductible, adds any co-payment or co-insurance, adds your 25%. And once all that out of your pocket reaches $7,400 in a calendar year, you go to that catastrophic coverage level. And there you're paying the greater of $4.15 for generics or drugs treated like generics, $10.35 for all other drugs, or 5% co-insurance. And it is there the greater of. So most of the time it's probably going to be that 5%. If you are getting a prescription for a 90-day supply of something, it's just going to triple your copayment or triple your co-insurance. So now we're going to the other side of that chart from the beginning, and we're going to talk about Medicare Advantage plans. These are those plans, again, are HMOs and PPOs, premiums as low as $0. The way that it happens, people always ask, how can you have a plan that costs $0? And the way that happens is Medicare pays private insurance companies to manage your Medicare A and B benefits. So we get money from Medicare, then the private insurance company uses that money to pay for your services. So they pay your doctors and hospitals, etc., for those services. They also use that money to add in those extra benefits, like prescription drug coverage, routine dental benefits, things like that. And those extras, those additional, vary by company. So you do want to check and see what's important to you and what the benefits are. When you go to the doctor or go to the hospital with one of these plans, you're just showing your Medicare Advantage identification card. you're not showing your original Medicare card. You can tuck that away. But you are continuing to pay your Medicare Part B premium. And then what you're asked to do, again, is pay your Part B premium, pay any plan premium here, and follow the plan rules. So the plan, again, may say you need to coordinate care with your primary care doctor. You need to pay a copayment, things like that. So the Medicare Advantage plans, again, are providing you all of your Medicare A and B benefits and adding in those extras. And there's two types of Advantage plans. One is the Medicare HMO plan, where you're designating a primary care provider, and he or she is managing your care. They're sending you referrals to see specialists for services, and you're staying in that Medicare HMO network, unless you have urgent or emergency services. With the PPO, there's a little more flexibility. There's an in-network component, and that is you're selecting a physician of choice, and you're seeing providers that are part of the Medicare PPO, Preferred Provider Organization Network. And that's when you're going to pay less out of your pocket. But you also have the option to go out of network with the PPO plans and see any Medicare contracted provider anywhere in the United States. So those PPO plans have a little bit more flexibility. When you first enroll in Medicare, you're going to get something called a Medicare and You Handbook. It's also available on the website, and it has great information about all the plans we've talked about today. The other important thing with the Medicare Advantage plans is they have something that's called a protection for you. It's an out-of-pocket maximum. So this amount varies by plans, but it's a set amount of money. Once what you've paid reaches that amount, you no longer have to pay your cost share for the rest of the calendar year. And this is the only type of plans, these Medicare Advantage plans, that have that out-of-pocket maximum. So when can you sign up? So there are different enrollment periods over the course of a year. There's something called the initial election period. I think we talked about this earlier when we talked about Medicare. So Medicare is your first step. You're enrolling in Medicare, you get your Medicare identification number and effective dates for Medicare A and B. If you start that 3 months before, as soon as you get that information back, you can then contact a private insurance company and begin the process to sign up for your Medicare supplement and prescription plan or your Medicare Advantage plan. And it'll be effective, again, if you're doing it before you're 65, it'll be effective on the first of the month in which you turn 65, just like your Medicare. If you're doing it on your birthday month or 3 months after, it'll be effective the first of the following month. Those private insurance companies don't backdate. There's also something called an annual election period. That annual election period is every October 15th through December 7th. You'll know it's this time of year because you'll get inundated with mail, you'll see ads on TV, you'll get phone calls. This is a time of year that you can sign up for plans, but you can also change plans. So if you happen to be enrolled in a Medicare Advantage plan and you want to change to a Medicare supplement and a prescription plan, you can do that during this time. And the change would be effective January 1st of the following year. There's also special enrollment periods. So these are unique situations. It could be that you voluntarily or involuntarily left your job, so you no longer have health insurance through your company. It could be that you moved outside of the planned service area, so you're no longer eligible for coverage. It could be that you now reside in a long-term care setting, something like that. So there's a lot of different scenarios. And you can talk to an insurance company or Medicare to see if your scenario meets these circumstances. Lastly, if you're a Medicare Advantage member, between January 1st and March 31st, you are able as a Medicare Advantage plan member to make one more change. So you can change from a PPO to an HMO, HMO to PPO. You can go from a Medicare Advantage plan over to a Medicare supplement and prescription plan. You can change insurance carriers. So you can make one change and it'll be effective the first of the following month. But again, it's only for Medicare Advantage members. So earlier in the presentation, I mentioned that the Medicare Part B premium is based on your modified adjusted gross income. So what happens here is when you sign up or enroll in Medicare Part A and B, Social Security does a 2-year look back. So if I was signing up in 2023, they're going to look at my taxes, whether I file individually or as a married couple, from 2021. And based on your taxes in 2021, they're going to look at what your modified adjusted gross income was. So let's just say, for example, my husband and I made $300,000. They would look here, married couples. So my Part B premium would actually be $428.60. Again, that's per person per month for 2023. Then in 2024, they'll do the same exact thing. They do that look back. And these numbers and amounts are subject to change. If you, so it's for Part B, and it's also an additional premium in addition to Part D as well. So it's your premium and then there's an additional cost that you would pay for that as well. If it's something, the amount that they're assessing you is something that you don't understand or don't agree with, say your income is very different in 2023 than it was in 2021, just as an example. You were still working, etc. There is an appeal form on the Social Security website, and it's something that you can appeal. It's not a given, but it is something that you can appeal. So we talked about Medicare, and this is Medicare's telephone number and website. We talked about Social Security, so that's their telephone number and website as well. I don't think I mentioned SHINE. So SHINE, S-H-I-N-E, stands for Serving Health Information Needs of Everyone on Medicare. These are individuals that are trained by all of the health plans. They work out of the senior centers or councils on aging in most of the towns across the state. They are very unbiased. They, again, don't work for any insurance company. And you can call the Council on Aging or Senior Center and set up an appointment to meet with the SHINE counselor free of charge. You want to do some homework first. You want to write down the medications that you take, doctors or hospitals that are important to you, any questions that you might have, and they'll meet with you either in person, by telephone, sometimes Zoom, and go through that information. They use a tool on the Medicare website called the Plan Finder tool, and they will input your information. It's something you can use as well, but they really know their stuff. And they'll give you a spreadsheet that'll list the plans that are best for you. If you want to enroll and sign up right then and there, you can, but you don't have to. So again, they're a wonderful, wonderful resource. I highly recommend them. And know that they get super busy between October and December. So depending on when it is you're turning 65, you might want to get to them early. As a Massachusetts resident, there's also something called a Massachusetts Medline. This is staffed by case managers and pharmacists from the Mass College of Pharmacy. They can answer questions that you have about drug interactions, about affording medications, etc. So it's free of charge, and their telephone number is there as well. Also, there's something called the Prescription Advantage Program that is available free of charge for Massachusetts residents. We all know prescriptions are really expensive. And so this is an income-based program. They don't look at assets. And if your income meets the criteria, and you can call them and see, you can get this free of charge and then save some money on your prescriptions. I also just have some Blue Cross resources there. If you're not yet a member, there's a telephone number. If you are a member, there's a telephone number. And our website is there as well. And that concludes today's presentation. I want to thank you all so much for coming. And I'll take individual questions after the presentation.